Hello, my name is Kani Tewald, and today I will be performing a non-surgical extraction on tooth number 30 on patient John Doe. John Doe is an otherwise healthy 22-year-old male with no medical complications and presents as an ASA Class 1. Today we will be using the proper PPE, a yellow gown, gloves, eyewear, and mask. And later on we will review Axiom and go over his medical history. Hey John, how are you?
I'm doing good.
Okay, so today you're here for an extraction, correct?
Yep.
Alright, so first I'm going to review your medical and dental history from last time and make sure your blood pressure, your heart rate, your respiratory rate, and your temperature was within normal limits. And I'll compare them to your vital signs this time. And if they're good to go, then and both within normal limits, then we'll proceed with the procedure. How does that sound?
Sounds good.
Okay, great. After reviewing his previous medical history, we found that all his vital signs were within normal limits. The blood pressure was 120/80, respiratory rate of 10, and the pulse rate of 60. Also, his temperature was 98.6 degrees Fahrenheit. So everything was within normal limits. And now today, I will repeat in taking these vital signs, and if they are in good comparison, then we will continue with the procedure. After retaking the patient's vital signs, we found that the patient's findings and recordings are consistent with the previous exam. Therefore, we will proceed with the extraction because all of his findings were within normal limits.
John, have you ever had any extractions before?
No.
How do you feel about that? Are you nervous?
Yeah.
Okay, there's a lot of things we can do to alleviate your stress, but there aren't too many problems. You might experience pain, bleeding, facial swelling, and Schiffman's problems. But if anything gets out of control, we'll just give you over-the-counter pain medications. Swelling is normal for the first 2 or 3 days, but besides that, there shouldn't be too many issues. Alright, so now that we've gone over what to expect and some of the risks that are involved, I just need your signature right here so we can continue with the procedure today.
Okay.
Thank you. So I just performed local anesthesia, and I'm going to probe the lower lip in the middle to ensure that he's numb and ready for the procedure.
I will now be introducing the armamentarium that will be used in this procedure. Here we have the bite block that will be used for jaw stabilization, the mouth throat screen and the 4x4 gauze. This is to prevent aspiration of any dental particles. The gauze is also used for hemostasis control after the extraction. Here's the periosteal elevator. It's used to reflect soft tissue and release the periodontal ligament around the tooth. We're going to move to the small straight elevator and the large straight elevator. They're both used to help elevate the tooth. Here we have the Minnesota cheek retractor that's used to retract the cheek on the working side. We're going to move over to the mandibular forceps. This is used to luxate or rotate the tooth out of the socket. Here we have the double-ended curette, and this is to remove debris and granulation tissue from the socket. We have the syringe, which is used to fill the saline and debride the socket of any debris. And right here are the cups that hold the saline solution. The patient should be semi-reclined at 30 degrees during the procedure because the supine position helps reduce the chance of a vasovagal incident or fainting. Because this is tooth number 30, it is in close proximity to the inferior alveolar nerve. So we have to be careful and use pre-op radiographs to help guide us and prevent damage. Now I will demonstrate the technique of a non-surgical extraction on tooth number 30. First, we will insert the bite block opposite to the working side. Using the cheek retractor, we will retract the cheek on the working side. Then we will insert the throat screen to prevent aspiration of small debris and particles. Using the periosteal elevator, we will loosen the soft tissue around the tooth. To elevate the tooth, we will take the small elevator and place it on the mesial surface of the tooth and turn it against the resistance and repeat on the distal surface. This will help expand the buccal and lingual plates. Once we can turn the small elevator without catching any resistance, we will take the large elevator and do the same thing. Using the mandibular forceps, we will luxate and extract the tooth, seating the forceps as apically as possible. Using the figure 8 movement, we will rotate the tooth and take it out towards the buccal. Next, we will double check that the entire tooth has been extracted by ensuring that the apex is present in the tooth. We will look for the 2 roots since this is the mandibular molar. Using the double-ended curette, we will remove the loose tissue and bone. We will irrigate the socket using the monojet syringe. Once this is done, we will remove the throat screen and bite block. We will then apply pressure for 20 minutes on the extraction site with a 4x4 gauze to slow the bleeding and repeat it if needed. Following the extraction, the patient should be seated in an upright position at 90 degrees. Following today's procedure, you should avoid excessive rinsing and refrain from brushing. Rinse gently with a syringe to clean your teeth. Be sure to ice your face for 20 minutes cycles over 24 hours. Ingest soft foods only and avoid hot and spicy food. Don't drink through a straw because that might dislodge the blood clot and that can cause a painful dry socket. Here are your discharge forms that include all the instructions that I mentioned. Before you leave, I also want to offer some ibuprofen since there are no contraindications in your medical history. We will give you some before you leave to prevent post-operative pain when you get home, but continue to take it every 4 to 6 hours and with food, but wait until you are no longer numb before you eat. Since you are classified as an ASA Class 1, there are no post-op antibiotics involved. So, do you have any questions for me?
Nope.
This is an emergency contact number.
Thanks.
Call if you have continued bleeding after today or there's extensive swelling beyond 2 to 3 days. It is normal to still have bleeding today since the local anesthetic is still wearing off. We'll see you for your follow-up appointment in about a week.
Sounds good.
Take care.
Thanks.